I don't see Lisa. Oh, there you are.
Okay, so House Bill 14 requires that labels for drugs and devices dispensed by a pharmacist in the manufacturer's original packaging include expiration date set by the manufacturer or a shorter period as determined by the pharmacist. Melissa sent around a few amendments that you should have received not too long ago. Delegate Krebs would like to amend this bill to make it an emergency.
Thank you for that, Lisa. I didn't see the amendments. I move the amendment for make it emergency.
Second.
Before we go to that, I would like to go to Delegate Cullison.
Thank you, Madam Chair. Without, I believe that we discussed this amendment in the subcommittee as a in concept, and I believe that the subcommittee that we would be supportive of that. The bill passed our subcommittee unanimously as without the amendment to make it emergency.
Okay, let me ask if someone would, Delegate Cullison, would you like to move the bill?
Well, are we going to vote on
Another amendment.
Usually we move the bill and second the bill and then take up
Okay.
amendments, and then we vote on the bill as amended.
Okay, then I'd like to move the bill.
Okay, is there a second? Hello?
Second,
Second.
Schlega, second.
Second. Thank you. I see that there are amendments. Before we do questions, let's go to the amendment. Delegate Krebs, would you like to move the amendment?
Yeah, so just like to move the amendment to make it emergency because some of the pharmacies are already doing this, and we want to make sure it takes effect as soon as possible to save our constituents money, especially on inhalers.
Is there discussion on the, is there a second?
I would second the amendment.
Is there discussion on the amendment? All those in favor say aye. All those opposed, no. Please raise your hand in the reactions box. Seeing the vote is unanimous, the amendment passes.
So
And
move the bill as amended.
Yeah, are there questions? None. All those in favor say aye. All those opposed, no. The bill passes unanimously, except I didn't mean to say no. I meant to say and. Okay, the bill passes unanimously as an emergency bill. Good job, Betty. The next bill we will take up is House Bill 130. Delegate Bleak. Tyler, there you are.
House Bill 130, establishment of Commission on LGBTQ Affairs. It was passed out of the Government Operations Subcommittee favorably. Not a unanimous vote. I don't have the exact vote written down. My apologies for that. Just a summary for those who want the reminder. The bill establishes a Commission on LGBTQ Affairs in the Government Office on Community Initiatives and tasks the Commission with certain duties related to promoting equity for LGBTQ individuals in the state. It was introduced last year and passed out of the House.
5 minutes at the most.
Madam Chair,
Delegate Rosenberg.
yes, this bill is, we discussed this bill in the subcommittee. It is very similar to other commissions that are of a similar nature in terms of advocacy. And the vote was comparable to the vote last year, and we would move a favorable.
Second.
Is there discussion of the bill? Okay, on the bill, all those in favor say aye. All those
Aye.
raise your hand if you're a no. I see a few hands going up in the no column. We'll give our staff, and it's not this, it's the symbol, which is good. And I see them going up. We'll give staff a few minutes to collect them all. I see 5 on my screen. Does that seem about right, staff?
Yeah.
Okay. The bill passes, not unanimously. With that, we'll move on to House Bill 191. Lisa?
House Bill 191 repeals the sunset on provisions of law that require the Maryland Department of Health to include psychiatrists and psychiatric nurse practitioners providing assertive community treatment or mobile treatment services, and any regulations that specify the types of healthcare providers eligible to receive reimbursement for telemedicine healthcare services. And the bill repeals the sunset on provisions that specify that a healthcare service provided through telemedicine by a psychiatrist or a psychiatric nurse practitioner is equivalent to the same service when provided through an in-person consultation. There were no amendments on this bill.
Okay, Delegate Cullison?
Thank you, Madam Chair. The committee discussed this bill and voted it favorably unanimously. I move the bill.
Second. Like to move the bill?
I move the bill.
Second.
Is there any discussion on this bill? Questions? All those in favor of House Bill 191, say aye. All those opposed, raise your hands. That bill passed unanimously. House Bill 233, Lisa?
As introduced, House Bill 233 requires individuals to be licensed with the State Board of Professional Counselors and Therapists in order to practice music therapy in this state. There are amendments that were sent around, and these are the same amendments approved by the Health, Occupations and Long-Term Care Subcommittee. The amendments moved the licensure requirements from the Board of Professional Counselors and Therapists to the Board of Audiologists, Hearing Aid Dispensers, and Speech Language Pathologists. The amendments add 2 music therapists to the board and remove the advisory committee language from the bill. They authorize the board to facilitate the dissemination of music therapy information, and they clarify that clinical training is included in the application requirement.
Okay, we've moved, no, Delegate Kelly.
Yes. So the subcommittee discussed this bill with the sponsor amendments. They supported the sponsor amendment unanimously and the bill unanimously.
Wait. Did you say sponsor amendment?
Yeah, so as Lisa explained, the bill was introduced with with them going under the counselor's board, but the sponsor came to the hearing with an amendment moving them to the audiology and speech pathology board.
You said sponsor apostrophe S.
Yes.
Amendment. That was
yeah, we're not co-sponsoring this, but we do commend the bill sponsor for doing a good job of getting all the stakeholders together and coming to agreement on this, and the subcommittee passed it unanimously.
Thank you. We do indeed congratulate her. This bill has had a long haul.
Yes, indeed.
So the bill has been moved and seconded. Did you move the amendments, Delegate Kelly?
Move the amendments.
Second.
I think it was moved and seconded.
Yeah.
All those in favor of the amendment, say aye. All those opposed, no. Please raise your hand.
Aye.
Seeing no hands, the amendment passes unanimously.
Move the bill as amended.
Second.
All those in favor, say aye. All those opposed, raise your hands. The bill passes unanimously. Congratulations. House Bill, you're welcome. House Bill 390. Aaron?
House Bill 390 was heard in the Health Facilities and Government Operations Subcommittee. Would you like me to explain it, or would you like Delegate Rosenberg to discuss what happened on that bill?
Why don't you let
You go first.
Just explain what it does and he can, okay. So the bill would require the University of Maryland Institute for Governmental Service and Research to conduct a study on the economic impact of the closure of Hartford Memorial Hospital and the subsequent transfer of its services to another campus under the University of Maryland Upper Chesapeake Health System. The institute would have been required to quantify the economic impact the closure would have on the city of Havre de Grace and develop a revitalization plan for the city. And that's what the bill did.
Delegate Rosenberg.
Thank you, Madam Chair. committee felt that adequate information had been made available to the affected parties, legislators, and the city of Havre de Grace. Therefore, there was no need for this bill, and it went beyond what is normal, appropriate for the legislature and the regulatory process with regard to future use of a hospital facility. So the motion was an unfavorable.
So why don't we move favorable? Oh, let's move unfavorable, please, if you would.
I move unfavorable, as was the vote in subcommittee, sorry.
Is there a second?
Second.
Is there any discussion on this bill? I see no hands raised. All those in favor of the unfavorable report, say aye. All those opposed, raise.
I'm opposed to the unfavorable report, Madam Chair.
Raise your hand in the icon.
Oh, do you know what, Madam Chair, okay, I'm really sorry. I'm using my phone. Hang on, let me do that.
Okay.
Okay, there we go. Yes,
Can you do
ma'am.
it? Oh, okay. I thought maybe you couldn't do it. Well, we learned something new. Great.
I learned something. I learned how to do it just now. Thank
Good.
you.
You're welcome.
Okay.
Okay,
Thank
we
you.
see 1, 2, 3, 4 unfavorables. The unfavorable to the motion, but the motion of unfavorable passes and the bill will be recommended to the floor as an unfavorable report. Is there anything anybody wants to ask or say before we leave? Congratulations on a super first day. It went really, really well, and we were a civil body, and I'm so proud of us being such a civil body. It was such a great thing. So thank you to all of you, everyone, and have a wonderful dinner with your families, and I'll see you tomorrow in hearings. Okay,
Tomorrow.
tomorrow.
Bye, Madam Chair. Bye, everybody.
Bye, everybody.
Bye.
Madam Speaker.
Adjourned.
Delegate Bendari, did you have a question?
Adios, amigos.